From forensic medicine point of view, expected INI-CET question, I have a topic to present today. Topic is MTP, Medical Termination of Pregnancy and Abortion Related Laws. See, Medical Termination of Pregnancy Act was introduced in 1971. So recent amendment was done in 2021. So please remember, 1971, the year was asked in an MCQ for JIPMER. So now remember this answer, introduced in 1971, latest amendment is 2021, right? Remember 2021. So 2021, remember the year 1971 introduction and 2021 latest amendment. So here I'll just outline what are the provisions that are retained as such, right? So the indications remain the same. So we do medical termination of pregnancy if maternal health is in danger, right? That is, second thing is if the to be born child is a defective child. Third is humanitarian grounds. Fourth is social cause, right? That is contraceptive failure, right? So I repeat again, those four indications remain the same, right? Four indications remain the same. Social cause, humanitarian cause, eugenic cause, therapeutic cause. Four indications remain the same. No age proof is required. If the woman says she's above 18, take it for granted she's above 18, right? No age proof is required, right? Then consent from spouse is not needed. Right? Consent from spouse is not needed. Say all these are MCQs, repeat MCQs in all India as well as we can expect in INI-CET. So I'll tell you the four indications remain the same. Age proof is not required. Consent from spouse is not needed, right? These are same as that of the previous acts, right? So please remember what I'm going to say. This is of utmost importance, right? Yes, this is of utmost importance. So the first thing is under the indication contraceptive failure, right? Under the indication contraceptive failure, this latest amendment included contraceptive failure for any woman or her partner. So please remember these two words, contraceptive failure by any woman, failure for any woman, or contraceptive failure on the side of the partner. See, this can be interpreted in the following ways. See, contraceptive failure for a married woman, right? Acceptable, MTP can be done. Contraceptive failure for an unmarried woman, yes, MTP can be done. So I repeat again, see, the recent amendment says contraceptive failure for any woman. So the word married is not present in the latest amendment. So MCQ can be asked in this way. MTP can be done for contraceptive failure in case of a married woman, right option. Unmarried woman, right option. Right? Or contraceptive failure on the side of partner or contraceptive failure on the side of the husband. Yes, option is correct. So I repeat again, contraceptive failure by a married woman or unmarried woman or on the side of the partner. All are correct, right? Then another important point, please pay attention. Another important point, this is the major change in the latest MTP Amendment Act, right? So when do we do MTP, right? When do we do MTP? So depending upon the length of gestation, right? Depending upon the length of gestation. If the length of gestation or gestational age, gestational life is up to 20 weeks, please remember the number, up to 20 weeks, one registered medical practitioner can do. I repeat again, up to 20 weeks, one registered medical practitioner can do. So forget about all those 20, 12 weeks present in the previous acts. So forget about those numbers. Just remember these numbers. 20 and 24, these two numbers, just remember 20 and 24, right? Forget about everything else. Don't confuse these things, right? Length of the gestation till 20 weeks, one registered medical practitioner is enough, right? If the length of the gestation is between 20 weeks and 24 weeks, two registered medical practitioners are needed. That is two opinion, right? Opinion of two doctors, two registered medical practitioners, right? So 20 weeks, one registered medical practitioner. 24 weeks, two registered medical practitioners, right? Yes. Now, there is a special provision. There is a special provision which says if there is a fetal abnormality detected using an abnormality scan, right, or an anomaly scan, right, it is possible, or due to chorionecular sampling, etc. If you detect a fetal abnormality, there is no gestational limit for medical termination of pregnancy. Please remember. So I'll repeat all these points again and again. Please pay attention. Contraceptive failure by any woman, whether married or unmarried, is acceptable. Contraceptive failure on the side of the life partner, it is male, acceptable for MTP. Length of the gestation up to 20 weeks, 1 RMP is enough. Length of the gestation until 24 weeks, 2 RMPs are needed. In case of fetal anomaly or fetal abnormalities, there is no gestational limit for doing medical termination of pregnancy, right? And one more thing, one more provision is added in this medical termination of pregnancy, right? So how do we detect fetal abnormality, right? It needs medical certification, right? How do we detect fetal abnormality? We do some test, right? Prenatal diagnostic test we can do, right? That is one option. Other option is ultrasonogram, right? So with this hint, I'll tell you how to go for this no limit in gestational life if we detect fetal abnormality. How to confirm it? Yes, the provision comes here. So medical board, right? Medical board. Now this medical board has to certify about fetal abnormality. To invoke this section, length of gestation is immaterial. You can do medical termination of pregnancy at any gestational life if we detect fetal abnormality. We need to have a medical board. The medical board shall have a gynecologist, a pediatrician, a radiologist. See, three: a gynecologist, a pediatrician, a radiologist. These three form medical board, and one more doctor. One more doctor the hospital can nominate. See, gynecologist, pediatrician, radiologist, they are indispensable. They cannot be changed. A gynecologist, a pediatrician, and radiologist is a must. First three are mandatory. And the last one more member from the hospital, you can change, right? Yes. So remember, 4 doctors are needed for the medical board. Gynecologist, pediatrician, radiologist, one more doctor, right? Of the hospital's choice, right? So if the board certifies the to-be born child has fetal abnormality, we can go for medical termination of pregnancy at any gestational age, right? Any gestational age. So we'll go to the next slide. Yes, I'll show you a photo. So supposing this photo is given in the MCQ, right? So this, anencephaly fetus, right? Anencephaly is a newborn anencephaly. So the abnormality present here is anencephaly. So supposing if this photo is given for an MCQ, you can do MTP till which gestational age? The answer shall be no limit, right? How do you confirm this? With the help of a medical board. Right, with the help of the medical board. So who would be the members of the medical board? A radiologist, a pediatrician, a gynecologist, and one more doctor from the hospital, right? I've told you recent amendments in medical termination of pregnancy, right? In this, I'll show you what are the relevant Indian Penal Code sections, relevant IPCs that could be asked for MCQ with relation to this topic. Yes. Now the photo here is a Clostridium perfringens infected uterus. So you look at the brown color, the cut section of uterus. The photo here is Clostridium perfringens infected uterus, right? Clostridium perfringens infected uterus. This is one of the repeat MCQ. The organism responsible for septic abortion. Organism responsible for septic abortion is one of the repeat MCQ with respect to INI-CET. Whether it is AIMS or GIBMER, it is a repeat MCQ. Clostridium perfringens. Now the photo is Clostridium perfringens infected uterus, right? So now I'll tell you the relevant IPCs. Only five IPC sections I'm going to tell you, right? So don't overburden yourself. Just 5 IPC sections with relation to abortion. I'll tell you. Please note section 312, section 312 of Indian Penal Code, which says doing abortion or doing miscarriage. See, with respect to IPC, miscarriage, abortion, premature expulsion are all the same, right? So don't take MTP into this IPC. MTP is different. MTP doesn't come under Indian Penal Code. Remember, that is one important point, right? We'll come back to that IPC. I'll tell you 312 of Indian Penal Code says doing abortion with consent of the pregnant woman is punishable, right? 312, miscarriage with consent is punishable, right? 313 is doing abortion or doing miscarriage without consent of the pregnant woman, right? So a subtle difference. 312 is miscarriage with consent. 313 is miscarriage without consent, right? Without consent, right? Now 314 is if a doctor attempts or any person, may not be a doctor, any person attempting to produce abortion, the pregnant woman dies. Now, death of a woman, pregnant woman, during miscarriage, right? That is 314, 314. Now, 315. So, what is 315? 315 is preventing a child from being born alive, right? Or we can simply remember this way, preventing live birth. Preventing live birth or making the child to die soon after delivery. Preventing live birth, or you can say causing the child to die. You can say infanticide. Now, infanticide is applicable with respect to 315. Remember, infanticide can be punishable with 315 also, 315 section also. So, preventing live birth or causing the infant to die, right? 315, right? Then 318 is concealment of birth and death, right? 318 is concealment of birth and death, right? So, only 5 IPCs, 312 miscarriage with consent, 313 miscarriage without consent, 314 is death of the pregnant woman while doing miscarriage, 315 is preventing live birth or born child to die, right? And 318 is concealment of birth and death, right? So I'll go for the recap again. So please pay attention. The most important point you should remember from this recent MTP Act is length of the gestation up to 20 weeks, 1 RMP. Length of gestation up to 24 weeks, 2 RMPs. If there is fetal abnormality, no limit for doing medical termination of pregnancy, and that fetal abnormality has to be confirmed by a medical board consisting of a gynecologist, a pediatrician, a radiologist, and one more doctor. So that's it for today. So with respect to medical termination of pregnancy and abortion, so we'll meet again with an interesting and a possible question scenario tomorrow. Thank you.
Best training, peaceful environment, PG medical entrance exam preparation were my expectations. I got them at Speed Medical Village in Kanchipuram. Today, I am a PG topper.
Speed Medical Village, a unique eco-friendly campus dedicated for PG preparation. Speed Medical Institute, a complete solution for medical education.